I'm Dr. Lisa Parsons, and I'm from Illinois. I went to podiatry school or medical school in Chicago. After that, I did a surgical residency in Knoxville, Tennessee. I ended up working for a doctor there for a couple of years, and then I bought my own practice. Had the practice for 15 years, which was pretty successful. A friend of mine down in Florida called and asked me to move down here and help him out, so I did. Then I ended up doing something else after a couple of years. Met Dr. Allen and started working for him part-time. So I do have a family. My husband, funny thing, he was my UPS driver at my office. Love at first sight, I guess.
Right. That's great.
We have 2 children. One just graduated from FSU, and my daughter's 16 now, so she loves to play golf. Well, I always wanted to be in the medical field, and physical therapy is kind of where I was headed. One day I went with my mom to see her podiatrist, and he's like, this is a great profession for a woman because you could have a family and work kind of 8 to 5 and be home and still be a doctor. So I looked into it and went into podiatry school. So I like medicine just because you help people, and podiatry was pretty good because people come in usually hurting and they leave satisfied. There was one case that a patient, this diabetic lady, came into the office and the whole top of her foot was pretty much gone. You could see the tendons and the bones sticking out. She came to me as a last-ditch resort because her orthopedic wanted to cut her foot off. So I said, nope, let's try to keep it. So I worked with the physical therapy department at the hospital, and about 3 months it started filling in and completely has normal skin over the top of it, and she ambulates and has no problems now. So we see anything that's related to the foot or ankle, from just like the kid that came in earlier, he's pigeon-toed, flat foot, needs to get into some orthotics. We have, one of my favorite things to do are ingrown toenails, because they come in dying and they leave and it doesn't hurt anymore. Older people, diabetics, just doing routine foot care, having their feet checked every 2 months is important, and keeping their nails trimmed. It's a wide variety of problems we see with the feet, bunions, hammer toes. Patients should schedule here because they're going to get the best care. I mean, from the time they call to walking in the door, having people up front meet them, coming back to the back with a medical assistant, and then all the doctors. I mean, I can't say anything bad about everyone's great. They all care for the patients and want them to get the best care and leave happy. Patients that call can pretty much get in to see any of the doctors when they need it. We'll always be here for them if they're having problems. We have new state-of-the-art equipment, from testing x-rays, digital x-rays, PVD testing, and they get the full treatment here.